For our video presentation, we chose to research prosopagnosia and superrecognition. So what is prosopagnosia? The name originates from Greek, prosop meaning face, and agnosia meaning ignorance. However, it is commonly known as face blindness. This, of course, doesn't mean one is literally blind when it comes to faces, but only that they cannot retain the image of faces. They see the general elements of the face, such as the cheeks, nose, and eyes, just not as clearly and as detailed as we do. And once they're not looking at you anymore, they won't recognize you. This is not caused by bad memory. Research shows that prosopagnosia is caused due to brain damage in an area that is specific to face recognition. But we'll get into it later in more detail. There are two kinds of prosopagnosia: developmental, which is also called congenital, and acquired. Before we get into all the details, we'd like you to try and get the idea of what it's like for someone who has prosopagnosia. Take a look at these faces. Don't tilt your head even though you really want to. Can you recognize who's in the pictures? Much better, right? You probably managed to recognize a few. Maybe some of you recognized all of them. It probably took you a little longer than it did now, right? When we see a face we know turned upside down, we see it, but everything seems a bit out of order. The idea is that for someone with prosopagnosia, the faces are always a bit out of order, making it difficult to recognize if they've seen that face before. To give you another sense of what it's like to live with prosopagnosia and the social difficulties that they may experience, here is a video. It is a bit amateur, but it gets the point across.
Hi. Do I know you? So many people. Have I ever met you before? I don't want to be rude. You know what? I'm just gonna keep a straight face and keep walking. Oh no, we must be getting new seats today.
Shannon, you'll be sitting next to Ben.
No. Oh, I hate getting help all the time.
You're so nice to meet you.
Oh, yeah, thank you.
Looks like time.
Gosh, this stinks, but I mean, at least some people show some kindness. Just keep walking, head straight, eyes straight. Let's just get to class.
Weren't you gonna say hi to me?
Sorry, I didn't recognize you.
What, are you blind, Shannon?
Leave her alone. You know the half of it.
Whatever.
Thanks, Mary Lou.
Hi, Miss Sofonis.
That's not Miss Sofonis, you just sub.
Embarrassing.
Now that we got a little understanding of what it's like, let's go into the mechanics of it all, beginning with developmental prosopagnosia. Developmental or congenital prosopagnosia is a lifelong condition that is apparent from early childhood and affects an individual's ability to recognize faces in the presence of intact sensory and intellectual function. It is hard to diagnose at an early age, and many prosopagnosia patients later in life say they were often considered absent-minded or lacking common social courtesy due to not recognizing people and not being able to understand why. Prosopagnosia can definitely be socially crippling. Individuals with the disorder often have difficulty recognizing even their family members and close friends. They use other ways to identify people, such as relying on voice, clothing, or unique physical attributes, but these are definitely not as effective as recognizing a face. So how is it diagnosed? There are a few neuropsychological assessments that can definitively diagnose prosopagnosia. Leading research groups typically use several computer-based face recognition tasks and self-report instruments to develop a perceptual profile and diagnose developmental prosopagnosia only where convergent evidence accumulates. The Benton facial recognition test is similar to a lineup. In this test, the subject is displayed with cards with different faces on them. Before going through them all, one face is selected and the subject needs to point out that face amongst the others. The famous faces test is where the subject is shown pictures with only the faces of famous people cropped. No hair is showing in order to focus only on the face itself, and the participant needs to identify who is in the picture. Much like the test we did in the beginning of this video, only in this test, the images aren't turned upside down. The Cambridge Face Memory and Cambridge Face Perception tests are all recognition exams where neuropsychologists assess face recognition skills. In the Cambridge Face Memory test, participants are required to identify target faces presented alongside two distractor faces. In the Cambridge Face Perception test, participants are required to reorder a sequence of faces according to their resemblance to a target face, much like the Benton facial recognition test. Identifying cases of developmental prosopagnosia is not straightforward. The condition is not listed in the Diagnostic and Statistic Manual of Mental Disorders as a psychiatric disorder, and no formal diagnostic criteria exists, which makes it that much harder to diagnose. Unfortunately, there is no cure for prosopagnosia. People who suffer from this disorder find ways of compensating for their inability to recognize faces. However, it remains a disability they have to live with. Researchers are currently working on ways to help individuals with prosopagnosia improve their face recognition, but they have yet to find one. Moving on to acquired prosopagnosia. This type of disorder is the result of brain damage commonly caused by a stroke, head trauma, or a degenerative disease. The damage done by the trauma affects the parts of the occipital lobes and temporal lobes involved with perception and memory, especially a specific region within each temporal lobe known as the fusiform gyrus. Evidence suggests that fusiform gyrus damage tends to bring about difficulties in face perception and recognition, whereas damage to other areas of the temporal lobes is associated with difficulties accessing the memories of faces. A person who suffers from acquired prosopagnosia understands what they have lost, having had the ability to recognize faces up to the point of damage. So how is it diagnosed? Diagnosing acquired prosopagnosia is easier than diagnosing developed prosopagnosia, mainly because the patient will notice the deficit in their abilities. The case is not as simple if the trauma happens to a child of a young age, where their cognitive abilities have not yet fully developed, which makes it harder to diagnose. Every case is different. Some people with acquired prosopagnosia will be able to recognize faces they knew before the trauma, but won't be able to retain new faces, whilst others may not be able to recognize even that. When it comes to testing and treating the disorder, the process is the same as with developmental prosopagnosia. On the other side of the spectrum, however, of face recognition is super recognition. This is the opposite to prosopagnosia. Super recognition is the ability to recognize almost every face one encounters. More precisely, 80% of all the faces one sees in their life. Just to give you an idea of why that's so amazing, a normal person remembers only about 20% of all the faces they see in a lifetime. People with this ability are called super recognizers, and they are super duper at it. These individuals are proficient at processing facial identities. So, how do we diagnose a super recognizer? Of recent years, the Cambridge Face Memory Test and the Glasgow Face Test were used to detect super recognition ability. These tests have now been surpassed by a test created by David White, a cognitive psychologist at the University of New South Wales' Forensic Psychology Lab in Australia. This new test uses Facebook images and examines a person's long-term recognition memory by showing them 20 images initially and then showing them 40 faces, where they must identify which faces they have previously seen. The second part of the test tests a participant's ability to match faces in different contexts, such as different lighting, poses, and distance from camera. It is important to note that as research is recent, we are yet to identify the scope and extensiveness of facial recognition. This is why humans vary, and one may remember 10,000 faces, whilst another may only recognize 1,000. At present, humans have been much more proficient at identifying faces than artificial intelligence or computer algorithms. Whilst technology is currently able to identify faces from a single photograph, through forums such as an e-passport or a Facebook recognition tool, humans excel when they are identifying people in different movements, lighting moods, and facial expressions. So what are the future research methods that we propose? From our research and investigation, we believe that as this area of study is so new, further neuroscientific tests need to be performed on the brain and cognition to understand this ability better. It would also be interesting to perform tests on young children, as the current literature suggests all test cases have only been focused on adults. Here we have a couple of interesting facts regarding super recognizers which you might find of use. My favourite fact is that those who have super recognition abilities often do not also have a high IQ or memory of objects. They seem to perform ordinary tasks no better than others. This showcases just how confusing and peculiar this ability seems to be. We will now show you a clip which highlights a super recognizer in action, and with that we'll conclude this video.
Don't know is that I set up a bit of an experiment.
Can I get a coffee?
5 people who are already set up in the cafe are going to interact with them.
Sorry, do you mind if I just write down the table?
Are you Michael Mosley?
I am, hello.
Hello.
Just to show how good Gary is at face recognition, we are going to ask him to try and identify those 5 people. While you were there, you were taking part in my experiment.
Very sneaky.
And all the people you saw in the cafe are part of that experiment.
Right.
Yeah.
And what I'm going to ask you to do is try and identify them in a few minutes in a lineup.
I genuinely wasn't expecting that. Josh has asked our 5 people to change what they're wearing. They have now joined 10 other people in the lineup. Will we recognise any of them?
I'm absolutely certain this lady.
This lady was in the cafe. Don't recognise this lady.
Yep, you served me a cup of tea.
This gentleman was in the cafe. He asked for the salt.
You look familiar, but I'm not convinced.
Don't recognise this lady.
I think, but I couldn't be absolutely sure.
Time for the results.
Michael first. Yeah, you got 4 out of 5. And Gary, you also got 4 out of 5.
But something unexpected has happened. During the lineup, Gary also recognised 2 additional people who were in the cafe.
He was in the cafe. I just remember him walking past and back out again. He walked in wearing a blue hooded top and he went into the toilet.
It turns out Gary is absolutely correct. These 2 did come into the cafe, but I hadn't seen them. They were only in there for a matter of seconds, but Gary caught a glimpse and remembered their faces.
So we hope you enjoyed our video, and maybe next time when someone doesn't recognise you, you'll be a bit more forgiving. Thank you.